Hello, my name is Sharika Jiscom, and this is the second video for Nursing Fundamentals final video. For this video, I will be doing IV piggyback medication administration. This first part of the video will technically be done in the medication administration room. And so the first thing to do is to perform hand hygiene. Okay, and I've performed hand hygiene, and now I will be checking the patient's MAR to verify the patient's name, date of birth, allergies, and what I need to do exactly. So after going through the MAR, I have read that I will be administering 500 milligrams of vancomycin per ml to this patient to treat a urinary tract infection. According to that value's urine analysis and CBC results. So continuing on, I will go in and get my medication for vancomycin. Now, because this is a IV fluid, mixing fluids, I have to check the compatibility of vancomycin to the other IV fluids the patients are already on. And according to the MAR, the patient does not have any incompatibility with NS or LR, so I will now move on to my medication preparation. So moving on, I'm doing another check of the MAR to verify patient's name, the date of birth, the drug or medication, the dosage, and frequency. And as I've stated before, it's 500 milligrams of vancomycin per ml. And it's in a reconstituted order. Okay, so I will perform hand hygiene once again and don on my gloves. I have gotten the medication out of the cart and they're all assembled in front of me. I am checking vancomycin for the expiration date, making sure it is actually 500 milligrams of the powder, and I'm checking for expiration date, clarity, and color. And so far, so good. I'm also going to have a bottle of normal saline, my 2 syringes, and for aseptic techniques, I will have alcohol wipes, and my piggyback sodium chloride pouch. Okay. So before I continue, I'll just do a quick medication calculation to know exactly how much normal saline I will be putting into my vancomycin for reconstitution. According to the order and on the bottle and from my calculation, I will be inserting 5.6 ml of normal saline into the vancomycin for a total of 6 ml into the container, and then after that I will use another syringe to withdraw 1 ml of the medication and insert that into the pouch, which will then become my piggyback pouch, where I'll bring to the patient room to administer the medication. So just going forward, I have my syringe here. This is a 12 ml syringe, and I will pull in air to 5.6 ml of air. Before I uncap, I just want to perform aseptic techniques. So I will use a alcohol swab to wipe off the top of my normal saline bottle, and another swab to wipe off the top of my vancomycin vial. Okay, so I've performed aseptic techniques. My air is drawn up to 5.6 ml. I will uncap, put the syringe down into the bottle, and then flip, and then withdraw 5.6 ml of fluid, which I will then pour into my vancomycin vial. Okay. Okay, I'm just gonna rest this one down for a little bit. I am uncapping and putting my first syringe into the sharps container. Now with this medication, because it's a powder reconstitution, I cannot shake vigorously, so I will just palm roll until the medication is even. Okay, so just a few more seconds. It's looking good. Everything is dissolving, diluting. Okay, and so I will then take up my second syringe and withdraw according to my MAR, my medication guide. I will take 1 ml of the reconstituted medication. So before I do that, I'm taking out 1 ml of air to insert into the bottle. I'm doing so while it's laying down, and then I will flip the bottle, the vial, and withdraw 1 ml of the medication. Okay, so I'm just going to recap the medication briefly. Okay, so in order to perform another aseptic technique, which is to clean off the IV piggyback port, I'm cleaning off the white part. Okay, so I'm just doing that, making sure that it's there. On a flat surface, I will uncap my medication again, doing one final check to make sure it's the correct patient, time, medication, dose, and frequency, and inserting it into the port. Okay, and I am just going to discard my syringe into the sharps container, and then I will write the patient's name, date of birth, the drug, the amount, the dosage, time, frequency, and my signature, and staple that and attach it to the pouch with the back so that the names is the medication names and everything is showing. Okay, and then I will just perform hand hygiene and take this medication to the patient's room. Okay, so moving on, when I get to the patient's room, hello, I'm introducing myself again. Hello, my name is Tarika. I will be your nurse for today. And before we continue, let me do hand hygiene again once more. And I'm just stating my purpose here. Today, I will be administering IV piggyback solution of vancomycin, which is an antibiotic medication to treat the urinary tract infection according to your MAR. And this was due to the report from your lab reports, your urine analysis, and blood cultures and CBCs. Now, vancomycin is a antibiotic, and there are some side effects. Some side effects are nausea, vomiting, and red rash. If any of these occur, please notify me immediately so we could get that rectified. And before we continue, I just want to do another check of the patient's MAR to make sure that I do have the right name for the patient, the right medication, the frequency and the amount with the correct patient. Okay, so I have all of that, and I'm just going to assess the patient's existing IV lock and making sure that the site, there's no edema, no redness, tenderness, or pain. Okay, so at this point, I will don on my gloves again, a new set of gloves, and I just want to do the additional 5 rights. So it's education, patient education, assessment, evaluation, documentation, and the right to refuse. So we've already established what the medication is for. It's to treat the It's an antibiotic to treat the urinary tract infection, and so I will just move on. Okay, so I will then remove the protective cover. Having the solution lie flat, and while I was in the medication room, I made sure that the medication was distributed evenly, but I'm just doing so now again to make sure that it's all even and it's all diluted into the piggyback pouch. I will then remove the blue protective covering from the pouch and attach the IV piggyback link to this. Okay, it's connected, and then I will make sure before I move on, because this is a new tube, I will clamp this shut, making sure that it's shut. And then I will prime my tube by letting some flow down, so in order to make sure that there's no air bubbles in. And then I will hang my piggyback pouch higher than the current IV drip that's going on. Okay. So another step for this would be to let me see. Another step is for the Y port. So I'll just wipe off the Y port that's connected to the patient, making sure that aseptic techniques were done. But in this case, I'm just verbalizing that I will do that. And I will then set my drip rate to 100 mLs per hour, and I will then unclamp. Okay, so once I've done that, my infusion rate has been set, my drip is flowing. It's the law of gravity. The new medication is at the top, the other one is down below, and I will then perform hand hygiene, tidy up my area, and document that I've performed the task, and inform the patient if anything is needed. Please let me know. And that ends my video. Thank you.